Every problem or illness of the lungs requires its own diagnosis, but many lung diseases have common symptoms. The following symptoms are among the early signs of lung disease. If you begin to experience any combination of these, and they keep happening, you should definitely consult a doctor. Coughing. Coughing is a way to clear the lungs of substances that shouldn't be in your respiratory system, like mucus or toxins. Shortness of breath. Many people shrug off shortness of breath, thinking they're just out of shape or simply getting older. Shortness of breath should not be taken lightly because it can be a symptom of a number of problems, including heart disease. Wheezing. Wheezing occurs when airways become narrowed or obstructed, causing an unusually high-pitched sound during breathing. It's often caused by inflammation and accumulation of mucus, or when a foreign substance has found its way into an air passage. Chronic wheezing is definitely a clue that you should see a doctor. Wheezing may also be a signal that a lung condition is worsening. Chest pain. This can be a symptom of a number of serious diseases related to the lungs and other organs. Never ignore pains in the chest area or brush them off as something like heartburn or acid reflux or muscle soreness. Chest pain might also indicate a lung infection if it's accompanied by a cough or fever. See a doctor as soon as possible if you're experiencing ongoing chest pain. Coughing up blood or hemoptysis. If you begin to cough up anything frothy and pink, mucus with bloody streaks or clots, or pure blood, it's probably a symptom of a problem that requires immediate attention. This is one of the most serious lung disease symptoms. Blue or purplish tint to the skin, especially around the lips and nail beds. This is known as cyanosis, and it indicates that the blood is not getting enough oxygen. Cyanosis can happen suddenly if some form of lung disease is acute, or it can happen gradually over a period of time as lung disease progresses. Swelling can be another symptom of lung disease, especially if it appears in the arms, legs, and ankles. This is why a doctor will check your ankles during a routine physical examination. Acute respiratory failure can occur when the lungs no longer provide oxygen for the blood, or when the lungs can no longer remove carbon dioxide from the blood. Respiratory failure may be the result of massive infection, lung inflammation, cessation of the heartbeat, or severe lung disease. Symptoms described in this video can indicate that an individual's chances of having a serious lung infection or other respiratory disease may be increasing.